Again, welcome everyone. My name is Beatrice Scheuerman and I'm the Small Grants Advisor with IDEAL. Before we start, we'd like everyone to be aware that we'll be providing French interpretation for this webinar. As you can see on the screen, please click on the interpretation globe at the bottom of your Zoom screen and select English or French. Once you've selected your preferred language, you can choose to mute the original audio, or you can hear it in the background at a lower volume. During the webinar, please ask your questions in the chat box, which is also located in the bottom of your Zoom window. There will be some time after the presentation for the Q&A. Today's webinar will be presented by Meredith Jackson DeGraffenreid, who will tell you about the perceived self-efficacy scale and toolkit that have been developed with the support of IDEAL's microgrants. To learn more about the IDEAL Small Grants program, please visit the FSN network on the link that was just shared in the chat box. Over to you, Meredith.
Hi, everyone. Thank you. And I just wanted to say thank you to IDEAL and USAID for giving us this opportunity to conduct the methods pilot and discuss what we did for this development of a cultural or contextual perceived self-efficacy scale. And before we get into the presentation, I'd like to acknowledge my colleague, Abul Kalam, who led this study in country in Bangladesh and was my co-pilot, or rather I was probably his co-pilot. So when you entered the chat, or entered the webinar, I believe you were asked to take a poll on what is EMIC. So here it is. So if you see the poll on your screen, if you could just select a choice here and decide what you think EMIC is, and just click submit. We're just going to do a quick poll just to see what everybody thinks about EMIC. Okay. And just a few more seconds to give everyone a chance to answer that poll. And then should we put the results up? Okay, so half of you said not sure, but a third of you said insider and also inductive. So let's go and talk about what actually is EMIC. So next slide, please. Yes, this one. What is the difference between EMIC and EDIC? So what is EMIC? It's a term that's usually used in anthropology and simply means insider. So those of you that chose insider, you were correct, about a third of you. And EMIC perspectives are cultural insider perspectives. So when we are working with participants in our project, we often use measurements that were developed outside of the context in which we're working. And that means they come from an EDIC or an outsider perspective. And so whenever I think about using EMIC approaches to draw out sociocultural knowledge, I always think about that image of Dumbledore from Harry Potter, where he's pulling his memories out of the pensieve. So when we're using an EMIC perspective, we want to extract that cultural knowledge from our participants. Next slide, please. And though measurement tools we use in our programs may have been validated in many places and are definitely of value, we still wonder, what could we be missing? Are we missing critical information for our programs by not understanding how individuals from a single culture define the concepts that we're trying to measure? And how do we know that the programs we design are going to result in meaningful and sustainable change to the people that we're working with? Next slide, please. And so this brings us to the purpose of our project in Bangladesh. And the reason we proposed the methods that we did in this pilot was because we wanted to develop a scale, a measure to measure perceived self-efficacy from an emic perspective. And that is a scale that's defined by the people who will ultimately be answering the questions in that scale. And self-efficacy is usually measured with the standardized general self-efficacy scale, which has been around since the 70s. And it's been used in many contexts and across the globe. And it's also included in the project level Women's Empowerment in Agriculture Index, or the ProWEA. And it is of value, and it has been proven to be useful in measurement. But could we be missing critical information by not understanding how men and women from the culture we're working in define self-efficacy? Next slide, please. So let's take a brief moment and talk about another foundational concept, and that is, what is self-efficacy? So it's generally defined as an individual's judgment of themselves. It's a self-assessment of your own capability to successfully perform a behavior. And one reason we wanted to explore a contextualized definition of self-efficacy is because it's also measured and analyzed to explain and predict behavior. And since our projects always have a focus on behavior change, we thought this is pretty critical. If our projects aim to change behavior and self-efficacy is a predictor of behavior, then shouldn't we try to better understand what self-efficacy means to the people whose behavior we're trying to influence? And then we can design more effective and sustainable programming. And furthermore, more recently, self-efficacy has been proposed as a factor on the resilience pathway. So Benet and colleagues call this the subjective resilience, and argue that we should be considering psychosocial and subjective measures, such as self-efficacy, when we are assessing household resilience capacity. Next slide, please. So one more foundational concept before we get to the process. So the methods we piloted in Bangladesh are considered cognitive methods. And cognitive methods can be used to extract that emic information from people. Using cognitive methods is an effective way to draw out what people within a culture know, so that you or we as development practitioners can better understand the culture that we're working with. And it's a way to collect data so that your participants define they make the definition of what it is you want to study or we're trying to study and measure. And when we're working with people in a cultural group and we're the outsider, it's always good to keep telling ourselves that we don't know what we don't know. And this can be true even within a culture, especially across regions or socioeconomic strata. Many of you are probably familiar with the term ethnography or ethnographic methods. And so the cognitive methods that we used are a type of ethnography. Next slide, please. So before we go on further, we're going to do another quick poll, but this time in the chat. We thought it'd be interesting to invite everyone to put into the chat any ethnographic methods you have used in the past. And these could be in-depth interviews, focus group discussions, or something more innovative. And I think we'd all be interested to see what our fellow practitioners have used and what the description of those are, so we can get an idea. So we'll just take a minute and let you put into the chat what it is that you've used in the past, if you have used anything in the past. See, key informant interviews and focus group discussions. Exploration of cultural proverbs, that's interesting. In-depth interviews, case studies, case stories. Shop-alongs. Structured observations, storytelling. So there's a wide range of methods that have been used. Pile sorts and free listing. Great. So that's pretty interesting. And feel free, if you want to share more with everybody that's on this webinar, you can put a description in or ask questions about those methods that were just listed. Okay, so let's move on to the next slide. So now that we've given the overview of some of these foundational concepts, emic, and self-efficacy and cognitive methods, we'll introduce the specific methods that we used. And they come from a body of cognitive ethnographic methods used in an approach that's called cultural domain analysis. So cultural domain analysis was developed by Romney, Weller, and Bachelder in 1986 and comes from cognitive and linguistic anthropology. And so what led to the development of this methodology was that Romney and his colleagues had developed a theory of what they called cultural consensus. And cultural consensus assumes that every member of a culture shares knowledge with other members of the culture, and that knowledge is very specific to the culture. And when we're talking about knowledge, we're not just talking about what you might learn at school. We mean what people think. So what are people's opinions, their perceptions? That's what we consider knowledge when we're using these cognitive methods to pull this out of people's heads. And so cultural domain analysis is built on this theory of cultural consensus, or this theory of shared cultural knowledge. And in cultural domain analysis, we go through a series of iterative data collection steps, and these document the content and structure of the knowledge with any domain that we want to understand. And by domain, we mean anything you want to study. So for our research, our pilot, the domain we were studying was women's self-efficacy, but it can be anything. So it could be feeding practices for children 6 to 23 months, or agricultural practices of maize farmers. So anything that you want to study, you can use these methods to do. Of course, we're talking about women's self-efficacy. So as I said, in cultural domain analysis, you use these iterative data collection steps to identify the content and structure of the domain you're studying, or what you're trying to influence with behavior change approaches. And I also said this is based on a theory of cultural consensus, or shared knowledge. So once you've collected the content of the knowledge from the people, then you want to know, is it actually shared? Is there shared agreement? And if you can show their shared agreement, then that's called a cultural model. And that model is like the blueprint for the shared knowledge. It's the mental schema of the shared knowledge. So when you get to the point that you want to know if what you've collected actually makes a cultural model, if it's shared, then with cultural domain analysis, you can quantitatively analyze your qualitative data and determine if the agreement between your respondents is statistically strong enough to call it a cultural model. And that bit of the analysis is called cultural consensus analysis, which is just an analysis to see if there's shared agreement. And it's part of cultural domain analysis. And it sounds like something fancy, but it is really just a principal components factor analysis. Next slide, please. So to me, an important contribution that cultural domain analysis can make to our field in development is that it operationalizes culture. And this is something that we struggle to do. You know, there's a lot going on around norms and how do we quantify norms? How can we measure that? And there's a lot of innovative work being done out there. But cultural domain analysis can create this quantitative measure of sociocultural norms from that qualitative data. So for example, in our research, we created a quantitative measure of the sociocultural norms around self-efficacy. And the methods can produce these tools that help us bridge the gap between knowledge and practice that we're so often missing when we're trying to measure. And we can't figure out why all this knowledge isn't leading to adoption of promoted behaviors. So for example, if we identify a shared cultural model of women's self-efficacy, then we can create 2 survey modules to use in our project monitoring systems. One would monitor consensus, or the shared knowledge, and the other would measure individual practices as self-assessed. Next slide, please. So part of what we wanted to do in this pilot was see if we could use these methods across different cultures to define and measure an abstract concept like perceived self-efficacy. Cultural domain analysis is not new. It's been used in many cultures, many contexts, but with an abstract concept like self-efficacy, we wanted to see, could we apply it, and could we apply it in different cultures to replicate it? So we chose 3 culturally distinct ethnic communities within the Chattagram Hill Tracts of Bangladesh, and these were Moro, Marma, and Bengali. Since all members of a culture share knowledge, it's also important when you're doing this to collect data from a wide range of members of that culture. So we collected data from participant households and men and women of different ages and people of different professions. I just want to remind you here, if you've got questions, put them in the chat, and we'll try to get to all of them in the Q&A, but also Column is happy to answer questions in the chat as well. Next slide, please. So now we get to the actual methods that we did of cultural domain analysis. So the methods are, we used cultural informant interviews, which are key informant interviews, free list interviews, group content and comprehension discussions, the cultural consensus survey, and finally the perceived self-efficacy scale survey. And each step builds on the previous step. Like I said before, they're iterative. And you start with the cultural informants who begin to describe the domain for us from the EMIC perspective. So because each step builds on the previous, the finding from each subsequent step can be used to validate what you found in the previous step. And this adds what we call EMIC validity to the scale that you're trying to develop, the resulting scale. Next slide, please. So in this type of research, the cultural or key informants are the sounding boards throughout the research, and they're like research assistants, and this is in the truest ethnographic sense. And that's why we've kind of started calling them the cultural informants here, because I want to separate out cultural from key, simply because in our field in development, we often make the mistake of recruiting VIPs from the community to be key informants. And here we intentionally are using the term cultural informants to emphasize that we want people who understand their culture and aren't just local government officials or health service professionals or teachers or other prominent people in the community. And that's because the cultural informants help us understand their culture and whatever it is that we're trying to measure or focus on in our programs. So in our case, we interviewed cultural informants first to help us begin to map out what that structure of the knowledge might look like around a concept of self-efficacy. And so throughout the research process, they can help you unpack the results and provide insight that you might otherwise miss because you are an outsider and you don't know the nuances of the culture. And you can continue to go back to them repeatedly to say, hey, we've, in the free lists, we found this. What do you, can you help us understand this? So it's not just, doesn't have to be a one-time interview. And so we wanted to purposefully identify people who are articulate, who maybe we've identified in the past as someone who freely expresses themselves, but who also maybe is somebody that's prominent, but would be able to talk with some authority about their culture. And so it's important to understand that demographics within the community don't matter at this point. You're really trying to get people who you think are going to be insightful and help you. Next slide, please. So as with any research, your first interview guides are going to be based on your own experience and knowledge, as well as what you learn from reading the research and literature. So the questions you develop are just meant to be a guide for discussion when we're talking about these first cultural informant interviews. And the interviewers should really let the cultural informant direct the conversation. Remember, we don't know if we've asked the right questions, and we want to learn from them. So it should be a free-flowing discussion and not a straightforward, okay, question one, answer, question two, answer. Of course, we want to cover all the topics in our interview guide, but often when you do an interview like this, you find that your informant already answers questions you might want to ask before you ever ask them without any prompting. Next slide, please. So after you've collected your data and transcribed them, it's time to analyze them. And we really highly recommend using a qualitative data management software. And for these types of interviews, since we don't know what we don't know, most of the coding will be inductive. That is, the data tell us the story. They tell us the codes and the themes. And we do this rather than creating codes and forcing the data to fit into them, because this is really exploratory. So if you're working with a team of analysts, like we had 3 analysts on this research project, we found 2 approaches that we would recommend when you've got a team that's working together. One is to have the lead analyst develop a draft code book by coding 2 to 3 transcripts and then presenting to the rest of the team for discussion and revisions before moving on to coding the rest. The other is to have all the analysts jointly code 2 to 3 transcripts and create a code book, and then discuss along while you're doing this. Now, with both of those options, after you've developed a draft code book, the remaining transcripts will be split up to be coded individually by the different members of the team. But of course, new codes are going to be created as that's being done. So it's very important that if I create 3 new codes, I share it with the rest of the team, and we ensure that all the transcripts use all the new codes too. And it's critical, and this cannot be emphasized enough, to have well-trained interviewers and analysts with experience. Next slide, please. So the next step are free list interviews. And as Russ Bernard says, free lists are a humble research tool, and you cannot underestimate the value of just doing a simple free list. They're open-ended questions where you just simply ask people to list stuff. Please list
You're on mute, Meredith. Hi, everyone. It seems like, Meredith, we lost you for a few minutes.
Oh, did you? Maybe I should turn my camera off. Bandwidth isn't that great here in Malawi.
Yeah, if you don't mind, let's try that. I think we lost you almost at the beginning of this slide.
Of free list interviews?
Uh-huh.
Okay. Let me go back to that then. Okay, so I was saying that the second step are free list interviews. And I said Russ Bernard, who's writes a lot of methods and anthropology guidance, he says free lists are a humble research tool, and you really can't underestimate what you're going to get, the amount of information you can get from that. And free lists are just simple, open-ended questions where you ask people to make a list. So it could be, I think I said, please list all the fish you can think of. In this case, we came up with several free list questions and asked people to, please list, for example, the example on the slide, all the characteristics of a confident woman. And it's important to record the exact order that respondents say the words or phrases they answer with. So if you see the responses that are on the example in the slide, male 1 who was interviewed, these were his responses in the exact order that he said them. And this is important for the analysis. And free list data can help validate the coded themes from the cultural informant interviews, and then help start to define further the structure of the knowledge. So from the free list results, if we're already noticing that many respondents give a lot of the same responses, then there's probably a good chance that there's shared knowledge. But you'll find out for sure with the cultural consensus analysis, which is the next step. I just want to point out too, it's okay to ask multiple free list questions. I think we might have asked 14 different free list questions, which might be variations on a theme, but you're trying to really capture as much of that structure, that knowledge that you can. Next slide, please. To analyze free lists, we use a software that was designed specifically for analyzing free lists, and it's called Visual Anthropack Free Lists, and it's a free software. Before data can be uploaded into Anthropack, it has to be cleaned first. And for free list data, this means recoding similar responses into one common code. If you don't do this, then every one of those different responses gets analyzed separately, and you don't want that to happen in the analysis. Even a misspelled word can get analyzed separately. So it's very important to pay attention to spelling and the coding. So you also just helps you avoid the mess. If you look at the example on the screen, we recoded the free list responses that are in the right-hand column under what makes a woman have confidence, or what gives a woman confidence. So these were all responses that came from different respondents. And all of them we felt could fall under one code called Does Quality Work. So before we uploaded the data into Anthropack, we went through all of our free list responses for this one question and recoded anything that we felt could go under Does Quality Work to Does Quality Work. That way Anthropack only analyzes it for Does Quality Work, and then you get a better understanding of the similarity, if people are responding in the same way. So before you can upload it into Anthropack, you then have to retype all the data into a plain text document in a specific format that gets uploaded and analyzed. And each free list question you have gets uploaded and analyzed separately. So all responses under one question would go into one document, and then that would get analyzed. And the analysis produces what we call a Smith salience for each coded item in the list. And salience is determined by several factors, including the order that the response was given by each respondent, the frequency that one response was given across all the respondents, and then it also weights which responses might be more representative of the group. But really what you need to know is that salience gives you a measure of the cultural importance of that coded term, of that response, in that blueprint of shared knowledge or the shared cultural model. So once you have the results for each of your free list question, then the analysts sit together and discuss the results to create a short list of free list responses from all of the questions that will be turned into consensus survey statements. Next slide, please. So developing the cultural consensus and the perceived self-efficacy scale survey modules is the next step. So if there's enough time, the optimal practice would be to develop and field the consensus survey first, then develop and field the perceived self-efficacy in module second. However, the reality that we all exist in is time and resource constraints. So what we did in our study was to do these steps at the same time, and then we later used the analysis results from the consensus survey to help us refine the perceived self-efficacy scale. And going through this process of comparing the results of the consensus analysis to the scale to refine the scale actually helps strengthen the internal validity of the scale. And I'll explain how we did this in a bit. Both the consensus survey and perceived self-efficacy scale are created as statements with a 4-point Likert agree, disagree response option. And that is strongly agree, agree, disagree, strongly disagree. For the consensus survey, if you look at the example here, we also included a 5th response option, which is I don't understand the statement. And that helped us know if we were still not creating statements that were understood by the respondents. We were a little worried this might throw off our results, but we found that out of hundreds, first of all, out of hundreds of respondents across 20 scale items, we got, I think, fewer than 5 people that even gave this response. So it didn't have any impact on the results at all, which also made us confident that we had gone through the process we'd gone through resulted in a scale that people, a survey module that people understood. So to create the consensus statements, we used the results from the free list analysis and looked at which items had the highest salience scores. So remember, salience tells us which items or responses in the free list are most important for the shared cultural model or shared knowledge. And since the consensus survey data will be analyzed later to see if there is a cultural model statistically, then the responses with the highest salient scores from the free list makes sense to use them to create your consensus survey statements. So to give an example, behaving well had high salience in our free list. It was listed as something that across several of the free list questions, whether it was about what helps a woman be more confident or earns respect or whatever, behaving well came up a lot. So we decided to include it in our consensus survey module, and we created a statement that said women who behave well have higher belief in their own abilities. And so when you create your consensus statements, you then create sister statements to go into the perceived self-efficacy scale or complementary statements. So the complementary statement that we created for the perceived self-efficacy scale was, I think I behave well. And the perceived self-efficacy scale, as we said before, is going to be a self-assessment on your own judgment about your own self and your own belief about your capabilities. And because of that, the perceived self-efficacy scale is administered only to women because we developed a scale for women's self-efficacy. So women are self-assessing themselves, but the consensus module is administered to both women and men because in theory, a cultural model or shared cultural knowledge is shared by everyone in the culture. So if we had created a men's self-efficacy scale, then we would have administered that to men. Next slide, please. And these are the consensus survey statements that we developed. But a general rule of thumb is to develop a minimum of 20 consensus statements to have enough survey items to analyze in the consensus analysis, which again is a principal components factor analysis. Some of the statements we created were not mentioned in the free lists, and this is an important point as well, because you do have some freedom to add statements that you still think are going to be relevant, or maybe there's something that you're programming for that you want to, there's a perception or a sociocultural norm that you really want to influence that relates to this, that maybe a lot of people didn't think was important. For example, like having equal rights equal rights with men. That came up a bit, but not much. It certainly wasn't part of it didn't come up in the free list very often, but we added it into the consensus survey statements because over time, our programming, we thought, might be promoting equal rights and, gender equality and gender equity. And so you can add these in if there are things from the literature as well. And then also another general rule of thumb is that at least 30% of your statements should be negatively worded. Because if all are written in the positive, then that can result in respondent bias. And when you do a negatively worded statement, when you go to analyze it, you'll reverse code it before you upload it for consensus. Next slide, please. And so this is the 13-item self-assessment, perceived self-efficacy scale we created. And you'll notice there are 13 items and not 20. And it's shorter because we intentionally condensed some items, partly to minimize respondent fatigue, because these 2 survey modules we created were put into a larger annual survey. And so the monitoring and evaluation team felt like the survey was already very long. And so we looked at what we wanted to, some of the consensus statements, and there were a few that we felt we could combine. So for example, support from husband and support from family, we merged into one statement regarding family support. And we took out community support, which if we didn't feel like there would be respondent fatigue, I do think community support would be something to put in. But some of the things too, we also thought we could get a measure of that from other data sources. So for example, we included a statement in the consensus survey that a woman does not need to be educated formally to believe in her abilities. And of course, that's negatively worded, but we could access the education information for our participants through our M&E system. So we felt like even though she wasn't giving a self-assessment of her education, we could go back and look and match to her actual education. Next slide, please. So once the 2 survey modules are drafted, now it's time to take them to a group of people from the community you're working with and get their feedback. This was a critical learning that we had from an earlier study done by Helen Keller in Cambodia that tested the comprehension of statements on the general self-efficacy scale. And women just didn't understand some of the statements, and it resulted in just providing an answer or just saying, I don't know. So at this point in our attempt to develop a culturally defined perceived self-efficacy scale, we want to make sure one more time that these survey statements we've developed are understood. And this is a best practice to do for any data collection tool. So to do this, we developed a feedback checklist and filled it in for each survey statement within group discussions. We asked, about each statement, and then we filled in a checklist about it, and then made final revisions to the survey statements in both survey modules. Next slide, please. And as I said earlier, if there's enough time, optimally, you do the consensus survey first, and then you do the self-efficacy second. But we did a modified approach and did them both at the same time. And that means we included everything in the perceived self-efficacy scale that we thought should be there. And then after we got the results, we eliminated items from the final scales. And the way we did this are detailed on the slide. First, we prepared the consensus survey data, and it gets uploaded into a software called UCNet. UCNet is not a freeware, but it's very minimal cost. You can do this in like SPSS or Stata, but UCNet just makes it easier when you're doing consensus analysis. Even though it is a factor analysis, it'll tell you on the results screen you have a cultural model or not. So it makes it very easy, and it also provides you with what's called a cultural answer key, the culturally correct answer key. And what this is essentially the weighted average response for every survey item, so every statement in your survey module. And that answer key helps you determine if any items from the consensus model should be dropped from the self-efficacy scale. So you look at the survey statements, and if on the answer key, The higher the score, the higher the agreement. So basically it tells you for one statement. So for example, if it's a woman should behave well to have support from her community, if that was a statement, then you would look and see, once you ran the analysis, does that have a high score? That tells you if there's high agreement in the answer key. And if there's high agreement, then there's shared knowledge about that. But if there's a low score, that tells you there's not a lot of agreement about that. And so you can surmise from that that this probably isn't a shared part of the model. So you can remove those complementary or the sister items from the perceived self-efficacy scale and run the internal reliability or the Cronbach's alpha to see if it strengthens your scale. And we did this several times, trying to find a scale that had an acceptable internal reliability, but which also still had enough items in it to reflect the cultural model. So at the beginning, I mentioned we did this work with 3 distinct cultural groups. And we did find that the methods worked across the 3 cultures. And we also found a shared cultural model of women's self-efficacy across the 3 cultures, but with some variation. So this resulted in us finalizing 3 different perceived self-efficacy scales, one for each cultural group. And they are similar, but they don't all share the same items. Next slide, please. One key lesson that we just learned over the years doing qualitative research and development, and it was certainly applied here, was it is critical to take the time to train the data collection team. Qualitative interviewing is a skill. It's kind of like journalism, and the data collection team needs to be well trained and have field practice conducting the interviews. And ideally, they go out, they practice, it gets recorded. You come back to the training and you watch and discuss how the interviews went so that they can improve, so that your data collection team can improve their skills. And also, this gives an opportunity to make changes to the questions in the end. And self-efficacy is an abstract concept. So even when our data collection team started the training, they discussed at length what it meant to them and how to talk about it with people in their communities. And they also will learn from the cultural informants new ways to talk about self-efficacy. Another tip is transcribe the interviews every night if possible. The lead researcher or data collection team manager should review the first transcripts and provide feedback to each team member on how to improve the interviewing techniques. And then when coding, it's hard not to have a bias, but remember again, we don't know what we don't know. This is an exploratory approach. We are pulling out the cultural or the emic knowledge. So we may have a bias and think something is trivial and not worth coding, but everything is worth coding. Everything is important. Next slide, please. So finally, just a couple more tips. The Likert scales are difficult for some people to answer, especially if education systems haven't taught critical thinking or the culture's not familiar with thinking in scales. So one recommendation is to start by asking first, just do you agree or disagree? And then saying, okay, you answered agree. So do you strongly agree or just agree? And that helps people, it breaks it into steps that helps people think about their responses. And for this type of research, when you're submitting an IRB for the ethical approval, it's really important to explain the purpose of the cultural or key informants. You know, we said key informants are often thought of as VIPs, and IRB boards, especially, you know, across the globe, might also think of them that same way. So calling them cultural informants may help, but also really emphasizing that this is ethnography and that each data collection step is iterative. And there may not, you can provide illustrative free list tools or other or subsequent data collection tools, but clearly explain that these are going to maybe change as you get more, as you get results from each step. And finally, and this should really go without saying, but we've probably all had this experience, make backup plans. Our Our example for this is our research team couldn't connect to the internet every day. We were asking them to upload their files at night, but they didn't have data coverage. And then, of course, there's always climate events and they can't get back to a place with Wi-Fi. So make sure everybody knows a Plan B process, and also that they know how to troubleshoot any technological issues they may have. And finally, just one more thing, and that is we've developed a practical field implementation guide to replicate this work. And we'd hope to formally launch it today and provide a link, but we're still making final adjustments. But it will be ready soon and be available for public use. And it goes through step by step how to replicate this approach. So thank you very much. And now we'll head into questions and answers. Okay, so should I start answering questions? So someone asked, how do you identify the local cultural experts? We were lucky that we were working in a project that was already being implemented. So we went through our field staff really and asked, you know, in the groups that you're working with, who's been very vocal, or who do you think is kind of been a shining star that might be able to be willing to work with us and be very articulate. But even if you don't have that experience, you may go in and do some preliminary informal discussions and try and find people, or maybe you've got contacts in the community and you could ask people to help. You might go to people that you think are VIPs and ask them, you know, could you help identify some folks that might be, that you feel like are really insightful and can think critically. But that's really what you're trying to do. It's not about saying, okay, we want to get 3 people that work in the local government, and we want to get 3 people that are the head of the farmers union or something like that. But you might go to those people first and explain what you're doing and try get them to help you identify people that they feel like that are talkers. You really kind of want talkers, actually. Recommendations for free or low-cost qualitative data management software. Not really. I mean, they're all costly. There's Max, QDA, and Vivo. If you can't, you know, let's say that we're working in a resource poor office or a resource poor team, and you can't use a data management software. I've managed qualitative data in Excel before. I've managed it in quantitative software as well. The qualitative data management software really helps you with the coding. That's where that's the beauty of it. And that's why we recommend it, especially if you've got a large amount of interviews. But if you've got, let's say that you're only collecting 8 cultural informant interviews because 8 is a recommended number. Maybe you don't need a qualitative data management software. Maybe you can just do it in Excel. And then you would just put all the responses in the cells below the questions and start to create your codes in new columns. Did you ever find that consensus differs by demographics within a culture? For example, how women versus men? Yes, we did. In this study, we were looking at, you know, we looked across cultures. So first we found differences between cultures, but within the culture, we did find differences in how men and women, not necessarily defined, there was a shared model, but there were variations, and that's called intra-cultural variation. And we found intracultural variation in our sample, definitely. You know, I think if I remember right, in our Monroe sample, women did mention equal rights, and they did mention education across the free lists, and that was not mentioned by men. And so when we ran the consensus, it also turned up that women, Monroe women, they had included, they had strong agreement about education and equal rights, and men did not. Can you describe the context and duration of the training you provided? I think you mean to the data collection team. And Colum, feel free to unmute yourself and come in here, because again, Colum led the research in country, and he did all the training for all the data collection teams. But I believe what we did is we trained before each step. So we trained, I think we did a 5-day training at the beginning for the cultural informant interviews. I think for free lists, it was 2 days. And then the survey module is a survey module. So I think we just did a 1-day training to make sure everybody knew what the survey modules were. And I hope that answered, I hope that's what you were asking. Did you get a sense of how folks just define, oh, sorry, can you describe the context and duration of the training? Oh no, did you get a sense of how folks defined behave well? Yeah, we did. And this is pretty much across the 3 cultural groups we looked at. And it was, again, we were talking about women's self-efficacy. So it was basically following social norms, dressing modestly, not having, I would say having manners. I think it was said in a different way, but having respect for others, not arguing with husbands. So some of the things that we weren't surprised to find, but very clearly came out. I mean, it wasn't an assumption that people said, oh, she should obey her husband and she behaves well. Raising her children well and teaching them good manners. Alyssa said, it's interesting to read these consensus survey statements. Some are counter to some of the things that we might think of as self-efficacious or empowering from an outsider. How do you reconcile this? So we recommend also not discounting the general self-efficacy scale that the WEA uses. And the reason we're saying this is, one, we would like to take this research and actually define empowerment. But this is where this whole idea came from, is we started out wanting to use these methods to do an empowerment measure, but we decided just to focus on self-efficacy first, just to kind of work the kinks out of doing this with an abstract concept. And we did find, when you look at the general self-efficacy scale, it's very much just about agency. It's about having agency for decision-making or control and ownership. But what people across the 3 cultures included in that was also access to resources and social support, and these things that we wouldn't have thought needed to be part of empowerment, or self-efficacy, but that's how they thought of it. So we did find, it's not presented here, but we took the self-efficacy scale and the general self-efficacy scale in the ProWEA, and we did analyze them with our resilience data and food security nutrition data, and we found that they had different effects. So with resilience capacity, the general self-efficacy scale explains a different portion of resilience capacity than the perceived self-efficacy scale did. And so we think it's important that you have both of them in there, because it did show that we are missing information that could help explain resilience capacity. Did we see areas of common pitfalls in probing skills, or did the training largely support good qualitative interviewing? Well, I have to give kudos to Colum and Miraj Rahman, who's on this call, because I believe that some of the qualitative interviewers that we used had been trained previously as well by Miraj. But yeah, there are pitfalls. Some of the common areas of pitfalls are, again, going back to question, answer, and not probing adequately and not allowing it to be a conversation. And that is just, it's so hard to teach people how to do that. You know, it's kind of an acquired and developed skill. So we did try to correct that and say, you know, okay, next time go back and here's what you could have done differently. But that's probably the biggest pitfall. Have you ever considered having women rank each other by perceived self-efficacy and see if ranking agrees with her own perspective? No, that would be interesting to do. What you can do in the consensus, when you have the consensus analysis results and you have the perceived self-efficacy, you know, I said the consensus analysis produces a culturally correct answer key. What it also does, though, it gives you a cultural competence score for each one of your respondents. So if I was responding if I responded to the survey, I would actually get a score for myself on how competent I am in this shared model. And so what's really cool is we can take that and we can look at perceived self-efficacy and essentially create a measure for, I myself may believe in this model, but I don't assess myself this way. And so we can start to look at different factors that may be influencing that, barriers, because that's really going to influence adoption of behaviors, you know, and and shifting in norms. So you might have perceptions and norms, but they're not equaling practice. So it really does give you an opportunity to not only assess as a group, but to assess across your group what factors may be supporting people or maybe people have in common, that, you know, you may see that all these women who believe in who have high competency in the model and also have high self-efficacy, what are the common factors among them? And you can start to really then try to focus your programming on that. The FGDs were single sex. We had, well, the FGDs they really were just group discussions. They were more about fielding the questions. But I do believe we had single sex groups for that. Could you develop a tool used in another similar population? Yeah, we should only, right now we think if you develop a perceived self-efficacy scale, it should be only used in the culture that you developed it in. But what we're hoping is that if more people use this and replicate, maybe what we will start to see is a larger shared model. I mean, like I said, we looked at 3 different cultures. Now, they all live in the same geographic area, but they are culturally distinct. And they did have one shared model, but that could have also been driven by sample size. And I should put that caveat on there.
Meredith?
Are we out of time?
We are out of time, unfortunately. Okay. It's the top of the hour, so we're gonna stop here. Thank you so much. That was a really interesting and engaging presentation. We would like to remind everyone that the presentation, as well as all of the recordings from today's presentation, will be shared with all registrants, and they'll also be posted to the Small Grants page on the FSN network. This concludes today's webinar. Once again, thank you all and have a great rest of your day.